name's Laura, and I'm going to be setting up a primary IV line and a piggyback line. So I would provide privacy, bring all my equipment. I would do my 5 writes and my 3 checks. Check the doctor's orders, check allergies with the patient, do 2 ID checkers with the patient. So now I'm ready to get my bag out, and I would check the date, make sure it's all good. Check it with the MAR again. Alright, so I'm going to just hang this for right now while I get my tubing out.
Okay, here's the lab.
And I'd be using Clean Technique this whole time. Untangle this. Sorry. No, it's okay.
Well, they have one like a big, I guess I'd have to ask, I thought it would be here.
Alright, so
Because see,
now I'm going to be ready to spike my bag.
oh,
So should I take it off?
Because it's, yeah.
Alright.
it is, oh, here it is, right here.
Alright, so my spike is sterile at all times. I don't want to touch it. And I would have done hand hygiene too. I forgot to do that. But I would have done that. Alright, so now I'm going to spike the bag by twisting, using this twisting motion, making sure not to spike through the other side of the bag. And I connect it up to the determining line. There's a little line here. So now that it's connected, I can hang it up. And the tube has been clamped, so the water's not running through, or the IV liquid isn't running through. I'm gonna get liquid into my drip chamber up to this line here. It's about halfway. And now I'm gonna prime the line by unrolling the clamp and letting the liquid come through to get out all the air bubbles, because we don't want that running through the patient. This is sterile too, so I don't want to touch that.
Well, it should be over here where the UIVs is, they're not used to be up here. I love this room.
Alright, so I can see it's dripping. I'm going to slowly do this, follow the liquid through, make sure there's no bubbles. Alright. It's good to go.
But they do it Monday morning.
Right, but
This is still sterile.
But see, if they're all semester,
Alright, and now I'm going to hang my piggyback. And the piggyback has to be hung higher than the primary line. So again, with the piggyback, I'm going to check the MAR, do my 3 checks, my 5 writes, and it's good to go. Check allergies, all that. Check the doctor's order. Alright, so I'm going to hang the primary bag lower.
you see what I'm saying? It looks like week 11.
And now I have to do the same thing. I have to prime this line to get all the air bubbles out. Well, first I'm going to spike the bag. So the spike is sterile, and so is the port.
See, that's why I was just looking for Monday, it's okay. It just says
Insert it with a twisty motion. Alright, and make sure that the clamp is closed. Alright. So now my piggyback is hanging higher than my primary bag. And now I'm going to prime the line. Making sure not to touch this. Keeping it sterile.
Yep, as long as they're done.
Get some liquid in my drip chamber.
Right.
But they're only from,
But if they're
they're
big,
from 10:30 till 14. So why are they doing this? See, I mean,
bubbles are out. And now I am going to be ready to connect to the port. But first I have to use the alcohol swab. And we use the highest port. So I would clean the primary port with the alcohol swab. Connect. And then lure lock it on.
We say 11 to 2, but then you have.
And now we're all good to go. And I would make sure that my tubes, both my tubes have dates and times and initials so we know when to change them. And that my bags have the name of the patient, date and time, and my initials. And then I would document what I did and come back and make sure that the patient is doing well. And then I would do hand hygiene. That's it.